Trying to get pregnant, how long is too long and when should you get help? Hi friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI, so I am a fertility doctor. And today I want to talk about trying to get pregnant, some basic facts I want you to know because I have been seeing so many patients lately who have been trying a really long time or needed to see a doctor earlier, but they ultimately thought they couldn't, or nobody told them that they could, or they just got mixed messages. So today I want to break down some of our probabilities of pregnancy and when it is that you really need to get more help if you're trying to get pregnant. First of all, this channel exists so that you can learn more about your body. So please consider subscribing and following along so we can spread our message to more people. Okay, the first thing to understand is that the rate of infertility is increasing, meaning more people are being diagnosed with infertility now than they ever were in the past. You used to hear us say 1 out of 8 had infertility, and now in the US, with people who are first trying to get pregnant, it is going to be 1 out of 5. Worldwide, we say 1 out of 6, but definitely that is a higher prevalence than we have had in the past. And there's a few different reasons for this, probably delay of pregnancy overall, environmental toxins, overall less healthy living, and other things that are contributing to both male and female infertility. When you're trying to get pregnant, it's really important to understand that the diagnosis of infertility and trying to get pregnant are really two different things. But we measure fertility in its most minute measurement called fecundability, which is the probability of pregnancy per month. And this was my area of interest when I was in fellowship. In fertility fellowship, first you do 4 years of OBGYN residency, and then 3 years of REI, which is reproductive endocrinology, all the hormones, and then infertility. And at least half of that is intense research so that you really understand how to evaluate literature. And I even got my master's of science in clinical research during this time period. But all of my research interest was on natural fertility and fecundability. So we as humans love the number 100. That is not the rate of getting pregnant. So if you are just never had a child and you're trying to get pregnant, and the highest it is going to be if you're under age 30 is going to be about 20 to 25% chance probability of pregnancy per month. If you are 30 to 33, it's 17 to 19% per month. If you are 34 to 37, it's going to be 11 to 12% per month. If you're 38 to 39, it's going to be 5% per month. And if you're 40 and above, it's 3% per month. This is if you've never had a baby, you're what we call nulliparous, and you're just trying to get pregnant. If you've had a child in the past, these numbers are a little bit higher because you now have what we call proven fertility if it's with the same partner, meaning egg and sperm can meet, the tubes were open, at least at some point things still worked, but there still is secondary infertility, which can happen. When you hear these numbers, especially 20 to 25% if you're under age 30 or 17 to 19% per month if you're 30 to 33, you can understand most people are going to get pregnant in 6 months. So especially if you are younger, the vast majority of people are going to get pregnant in those first 6 months. So once you've even passed the 6-month marker, it is less likely, although not impossible, to get pregnant. The true definition of infertility is going to be if you are under age 35, trying to get pregnant for 12 months with regular menstrual cycles and being able to have intercourse. If you are over age 35, that definition is shifted to be less than 6 months. The only reason why the definition changes based on age is just the urgency by which you need to get an evaluation, because as you get older, you have less time to complete your family. We know that maternal aging and having lower number of normal eggs starts to contribute. And that's really why we see these fecundability rates really drop as we get older. It's not necessarily that all of the eggs are bad, but as those eggs sit inside the ovary over time, they absorb the wear and tear of our life. And the longer they have been sitting there, the harder it is for your body to randomly ovulate a good one or one that is euploid. Therefore, the pregnancy rates drop and the miscarriage rates increase as we get older. So if you are older and you have less time and more of your eggs are abnormal, we do not want you trying as long before you find out if there's any hard stops. Meaning, are your tubes blocked? Is the sperm normal? How many eggs do you have left? So the definition of infertility is what prompts us to go and do more testing to try to figure out potentially what could be causing what is going on. So a normal fertility workup is going to include a thorough history to understand if we think you're ovulating, some hormone testing and measures of ovarian reserve, talking about egg quality and your age, your anatomy, so uterine and tubal evaluation, and a semen analysis. So this is the basic testing plus some preconception testing. If everything comes back normal, right? Most of us would consider that the best case scenario. If everything comes back normal, you now have unexplained infertility. And the longer you've had unexplained infertility, the harder it is going to be for you to get pregnant because there is something standing in the way. I always tell people unexplained is not that there's nothing going on, is that there's nothing that's easy to test. It is likely due to some type of environmental, maybe there's inflammation or autoimmune disease, something about egg or sperm functionality that we don't have an ability to test on a test. When you have unexplained infertility, so based on your age, either 1 year or 6 months, you've had regular cycles, you're trying to get pregnant and you're not, and now you have this unexplained diagnosis, your rate of conceiving drops down to 4 to 5% per month if you've been trying for 1 year and 2 to 3% per month if you've been trying for more than 2 years. So those numbers are not zero. Certainly people with unexplained infertility go on to get pregnant, but that's very hard, especially if you are older, you have less good eggs, you have less time to grow your family, or you're trying to for your first child. And so that's why we try to accelerate treatment. So if everything's normal, that doesn't always mean you just keep trying. Sometimes it does, but you have to understand you're accepting that lower chance of it working. So if that is okay in your family planning goals, that's okay. But if somebody just says, everything's fine, I don't know, it's unexplained, keep trying, that is unlikely to result in a baby. Not impossible, but unlikely. And the longer your fertility duration, the lower the chance that you're going to get pregnant per month. The other thing I see all the time is that people who have some barrier to trying to get pregnant still feel compelled that they have to wait 6 months or a year based on what a doctor said or somebody online. If your periods are not regular, go see a doctor. The end. Regular means predictable within a couple of days every month. So I saw a patient today whose cycles were 86 days, 70 days, 54 days, 27 days. Do you think that's regular? No. If I saw a patient who had 30 days, 32, 31, 32, is that regular? Yes, that's quite predictable. If your cycles are not regular and predictable, go see somebody. If you have significant spotting in the luteal phase or concern for a luteal phase defect, please get an evaluation. If your periods are so painful that they interfere with your quality of life, we have a concern that you have endometriosis. You should talk to somebody. If this makes it hard to have intercourse, absolutely. If your partner has difficulty maintaining, achieving an erection or ejaculating, you need to go see somebody. I saw a couple who've been trying for 8 years, but they've barely been able to complete the act. And there's modern medicine techniques, there's medicines that we can use, there's procedures we can do to help that couple conceive, but we need to intervene to have a better outcome when we're younger and not when we're older. So when we put this together, who needs to see a fertility doctor and when you should come in? If you have regular periods and you can have intercourse and you have been trying to get pregnant for over a year, if you're under age 35, 6 months if you're 35 to 40, or 0 to 3 months if you're over age 40 and you're just starting your family for sure. If you have irregular periods, extremely painful periods, problems with intercourse, you need to go see a doctor. So those are hard stops where you don't need to just keep on trying. Even if you have a baby in the past and now you're having difficulty and you're meeting these infertility diagnoses, go and see somebody. Please don't just keep trying without at least getting an evaluation. A lot of things can change from baby 1 to baby 2. Sperm can change, anatomy can change, you can develop disease. So it's really important for us to have a full picture. Ultimately, again, even if we use the statistic 1 out of every 5, that still means the vast majority of people are not going to have infertility or need to see a fertility doctor. Please remember though, infertility can be silent. You don't know who has it. Please refrain from asking people if they're pregnant, when they're going to be pregnant, when they're going to add to their family. You do not know what other people are going through, and comments like that can be extremely hurtful to those of us who live in this world or who are unfortunately in the family of having had infertility in the past. As always, I hope you learned something today. Please consider subscribing, ask a comment below, share this with friends. You can also follow along on Instagram at Natalie Crawford MD, or you can listen to the As a Woman podcast. Thanks, friends.